Hi there, I'm Dr. Lori Trost. I'm a dentist in Red Bud, Illinois. I am the founder of Trost Dental, and I'm very excited to show you today one of the new products that we use in our practice. And we've really come to like this product because it has some enormous benefits that I want to share with you. It's the NCIS. It's a new cartridge integrated system. And what it does is it helps make impressioning easier and more simple, not only for me as a dentist, but more importantly for you as the dental assistant. And ultimately, our patients win. Let me show you some key benefits. To start with, many of the older type dental impression systems are presented in different cartridges, and with those cartridges are different syringe tips. And there's a lot of times confusion can arise because different tips often are put onto different cartridges. What this means is maybe the material doesn't get mixed as quickly or adequately as it should. There's different types of ratios that the impression material goes through on these cartridge tips, and guess what happens? Maybe they're not mixed completely, and therefore the material doesn't set properly, therefore the impression does fail. So guess what? Let's make that simpler. Let's get a shorter tip, which is what they've created here, and more importantly, let's make a tip that fits securely and easily onto the new system. And you can see here, one of the biggest benefits is this new system that easily can be inserted because it has a direct feed right into that little keystone right there, that little Stonehenge fin to make that happen. Often the older systems you'll see will have kind of a V'd notch, and to really secure that V'd notch into the tip onto the cartridge is very, very difficult often. You have to secure that. So that takes a little bit of jostling to do, and often again, if it's the wrong tip maybe, or you're in a hurry or something is happening because there's so much synchronization going on during the impression making and taking phase and procedure, that often gets overlooked or gets misplaced or not assembled correctly, and so then a failure can happen. So they really simplified this. Then the other nice thing about this system, you can see here, once this is loaded, initially you're going to go ahead and you're going to express this and just bleed the tip, and you're going to bleed the tip one time. That's it. This really helps to reduce any kind of waste, more importantly cross-contamination. And you can see here how easily now this is ready to be inserted, secured, and you're ready to go forward. You can load the tray with this material. You'll notice here there's a blue label on the cartridge. This indicates this material is used for a tray loading type material. So every tray will be loaded with a blue labeled material. And in this case here, you can see this is Aquacel Ultra Plus. This is the heavy-bodied material. More importantly, what you're going to read on this material as well, it has a 1-minute working time. So it's really critical to make sure that the system, since it's simplified, you really don't have the tendency to really go over that time, because you're able to express this material simply and easily, okay? Which is a really great benefit. Now, for those kind of cases that say for simple, like a single crown perhaps, you would use this kind of delivery system. For quadrants, this is perfect, but for full arches, there's a different system now. Here we have the new Deca, which is the dual mix 350 milliliter cartridge. Obviously, it's much larger. It fits into a dedicated machine that will help express the material out into the tray easily, simply, and more importantly, consistently. So you have a really, really good mix. Many of these machines, you get cross-contamination again because of the tips, and it's really important and critical to understand that these tips need to be secured, they need to be fresh, and they need to make sure they're not contaminated. So again, you can see this nice design, and you can see how easily this will fit into and be secured tightly and easily. Now, what you're going to want to notice too on the cartridge, there's a diamond listed on the label. When you go to the machine, once it's been turned on, you're going to go ahead and insert this secured tip and the entire cartridge into the machine. You're going to want to make sure that you absolutely locate it and snap it into place. Then from that diamond, you're going to want to go ahead and place and push the diamond indicator in the machine itself. Now you're ready to close the lid and you're ready to dispense any of the material. When you first use this cartridge initially, you're going to want to go ahead and bleed a 3-inch ribbon onto a piece of paper or paper towel just to make sure that the material is moving, and then you're ready to express it into your tray. Now, on the machine setting here, you have two different buttons. You can push a button to load, which will go slower. This could be perhaps maybe for a syringe delivery that you want to place and load a syringe. Or you can place your finger on a faster setting. So as I'm going to bleed the ribbon here, I'll show you both of these settings, and I'll show you again in the tray as well. But this is a little bit slower dispensing, and sometimes that's a nice and easier method to go about. Again, hold your finger entirely on the button as you do it, and you can see here, this ribbon now is going to be a lot faster. The faster set will definitely come out and express quicker. I'm going to go ahead and just show you again the faster set here. You can see how nicely and easily this ribbons into the tray. If I go ahead and place a slower setting, you can see the speed in which that now fills, which again, probably would give you a little bit more control too. So depending if you're doing quadrant dentistry, maybe you're doing a full arch, you can select which button is more adequate to load your tray properly and easily, and then you're ready to put that into the mouth. Let's go back to single unit crowns, because that's where we really need to, and we do most of those. We do 20 of those usually. The average office does a month, and it's really important to know very fundamental, basic, good dentistry, because you've got to do this procedure many times and do it well to really succeed and to really have your bottom line affected properly. And this is what this whole system is about. It's about saving material. It's about less waste. It's about maybe getting 10 more, which is really astounding, 10 more single unit crowns in one cartridge, which to me is amazing. That's such a cost benefit, and it's a simple thing to incorporate within your practice. And by the way, you're using a material that is the leader in the impression market. So I'm really confident when I use Aquacel Ultra Plus, it is a great choice. Now, for example, if I'm going to do a single unit crown with, again, the color-coded material, the red will always be a mixing tip indicator. So if you see a red label, you're going to go ahead and use and load a red dispensing tip with that. Along with these dispensing tips too, you'll notice they have a margin delivery system syringe tip with. So you can go ahead and get that inserted ahead of time and have that ready to roll pre-patient or pre-procedure. You're going to want to go ahead and load and bleed your cartridge just like you would do normally. And once you've done that, you don't need to bleed that cartridge again. You can see here exactly how we've done that. And here you can see again the Stonehenge keyway here. We're going to go ahead and place that and insert that and secure that simply and easily, and it's ready to go. Assistants find this to be really, really beneficial because it's a secure delivery. When they pass that and they know they've placed this easily to assemble, it's right there ready to go. And they can really hold on to this and know that it's not going to be flimsy or it's going to fall off or bend. And that's a really great feature as well. Now, another thing I want to mention is every time that you're using perhaps a triple tray that has a cloth liner, you need to paint an adhesive on that tray. It's really critical because the impression material will sit on the tray better, it will adhere better, you'll have a better impression because of that. So just take the time, paint the trays. You can do that anytime you get a little free time in the office, but this needs to dry and be on the tray for at least 5 minutes, and then it's ready to be used for the procedure. So in this case here, I'm going to be using my tray material, which is going to be the blue labeled material you can see here, as well as then my red material here that I'm going to use for my mixing tip. So again, the color coordination is there, the cost savings is there, the consistent mix, and you can see immediately how well this will be expressed and how easily it will come out. Now, the other thing I want to notice too and pay attention to and share with you is how nicely this just dispenses. The flowability of this is just really amazing. That's one of Aquacel's standout features. It's the leader in the market for that. It's hydrophilic. It just got such great properties to it. It's just one of those materials that just, it's one of those you just want to have in your toolkit all the time. I'm going to go ahead now and put my wash material in for my tray. And what you're going to notice here, this is again, like I talked about earlier, it's a heavy set material. Many times this material is so viscous to dispense into the tray, it really takes a lot to gun it into that tray, doesn't it, and express it in there. You can see here, that's not such the case here. And again, I've not violated any of the working time. I'm going to go ahead and place it over my preparation and be done with it there. So you don't have cross-contamination. You have a fresh mix ready to go. Consistent, you're going to save money, you're going to save time, and I'd really encourage you to try this and implement this system in your practice. I think you'll find it's a winner.